Hello, my name is Ahmad Irham bin Ahmad. I am year 1 EMS medical student. So today I would like to present my SSM topic, which is musculoskeletal system, specifically the bone. The agenda of this presentation consists of 6 parts, which are the introduction, anatomy of bone, the physiology of bone, the bone remodeling, related disease, and the last one, the well-known orthopedic specialist. We move to the first part of this presentation, which is the introduction. So musculoskeletal is composed of two broad systems, which are muscular system and the skeletal system. The muscular system is all types of muscle in the body. For the example is skeletal muscle, cardiac muscle, and the smooth muscle. So skeletal muscle are attached to the bone by the tendon. So cardiac muscle will form the heart, and the last one is the smooth muscle, which line the wall of blood vessel and the hollow organs. But the main focus of this topic is the skeletal system, which consists of bones, joint, and associated tissue. The bone are the framework of the body. The joint are the meeting point of the bone. Cartilage and ligament are the associated tissue. So we move to the next part, which is the anatomy of bones. It is a study of the structure and shape of bones, as well as their relationship with other parts of the body. So there are 6 classifications of the bone, which is the flat bone, sternum, the long bone, which is the humerus, the sesamoid bone, which is the patella, short bone, carpal, irregular bone, the vertebra, and the last one is pneumatic bone, which is the maxilla. And there are 3 main types of cell in the bone, which is the osteoblast, that bone forming cell. It secretes the organic component of the bone matrix. The second one is osteocyte, which is a matured osteoblast in the bone matrix. It maintains the bone growth and the density. And the last type of the cell in the bone is osteoclast. It is a large and multinucleated cell. Its function is reabsorb the bone matrix by releasing the enzyme and acid. There are 2 main layers of the bone, which is the compact bone and the spongy bone. The compact bone is the dense bone that forms the outer shell of all bones, but the spongy bone is the light and less dense of bone within the inner medullary cavity, which is a hollow part of the bone that contains the bone marrow. Compact bone also consists of a number of irregular cylindrical units, which is the osteon, and it has the harvesting system. But the spongy bone contains the blood forming cell, which is hematopoietic stem cell in the bone marrow. Compact bone also heavy and tough, but the spongy bone are light and spongy. So the function of the compact bone is a structural support, and it store and release the calcium, but the spongy bone play a crucial role for the blood cell production. We move to the next part, which is the physiology of bone. The first function that bone provide is the support. It provides somatic rigidity, structural outline, and erect the posture. The second one is the movement. The bone will work with muscle and joint to enable movement and mobility. The third one is the protection. So the bone will protect the internal organ and the other structure from injury. For the example is the thoracic cage protect the lung and heart. The fourth one is blood cell production, which is the bone can produce the RBC, red blood cell, and white blood cell, and platelet for the body immune system and the blood clotting, since it have hematopoietic stem cell. And the last one is the shape. Height is linked to the skeletal framework. So the next part of this presentation is the bone remodeling, which is there are 4 phases in this bone remodeling. So the first phase is acute inflammatory phase. It initiates inflammatory response. In this phase, hematoma will form and cellular activity will occur, such as hematopoietic stem cell. And this phase lasts approximately 7 days. So the second phase is soft callus formation. Around 14 days, the collagen and cartilage are produced in this phase to bridge the gap. So soft callus also provide the stability and act as scaffold for new bone formation. The third phase is the hard callus formation, which is around 21 until 28 days. Minerals are deposited by the osteoblast onto the callus. It's more rigid and bridge the fracture gap. So the last phase is the remodeling, which is occur around 28 days above. The osteoclast remove excess the bone tissue, and the osteoblast deposit the new bone in this phase. So the bone regain its original shape and strength. This will be the interesting part of this presentation, which is the related disease to the bone. One of the common disease that related to the bone is osteoporosis, the condition that weaken the bone and make them easily to fracture. In a simple way, is fragile. This disease occur when the imbalance between the newly created bone tissue and the loss of the old bone tissue. The common symptom of this disease is first back pain. Second one is the loss of height over time, a stoop posture, and the bone break more easily. So there are many prevention ways, such as the adding calcium and vitamin D in diet, have a balanced healthy diet, do a regular exercise, and quitting smoking. So there are some medication that can be used to treat this osteoporosis, which is the hormone therapy. The second one is zoledronic acid, and the third one is abaloparatide for the severe osteoporosis. Now we are at the end of the presentation, the last part, which is the well-known orthopedic specialist. In Malaysia, we have Prof. Dr. Azhar Mahmud American, which is the president of Malaysian Orthopedic Association in 2019. He is fellowship in hip and knee surgery. He expertise in orthopedic trauma surgery and hip and knee replacement. For the world-known orthopedic specialist, we have from Austria, which is Dr. Christian Gabler. He has over 28 years of experience. He is a PhD holder. He specializes in traumatology, sport traumatology, and sport medicine. He has served as a doctor in UEFA tournament in 2008. And gentlemen, as we conclude today's presentation, I want to express my gratitude for your time and attention. I hope I leave with valuable insight. Thank you so much.